Good evening to everyone. Me and my team, we will present about blind and visually impaired. Causes of visual impairment. Causes impairment can be caused by a variety of factors, ranging from congenital conditions present at birth to accurate conditions that develop later in life. Understanding the causes of visual impairment is essential for prevention early detection and accurate management. As you guys can see, number one is congenital condition, and the second is accurate condition, and the third is systemic device, and the last one is environment factors. Congenital condition is because of genetic disorder. Conditions like congenital cataract, retinitis pigmentosa, and albinism are caused by genetic modifications inherited from parents. And the second is because of birth trauma. Injuries sustained during birth, such as accident deprivation, can lead to visual impairment like cerebral visual impairment (CVI). For the second is accurate condition. Age-related macular degeneration, or we call as AMD. AMD is leading causes of vision loss among older adults and affects the macula, the central part of the retina. And the second is glaucoma. Glaucoma is a group of eye conditions characterized by a damage to the optic nerve, often caused by increased pressure in eyes. This is the example of cataract. Cataract results from clouding of the lens of the eye, often associated with the aging, but can also occur due to other factors like trauma or radiation exposure. Systemic disease. Systemic disease is what a neurological disorder, condition affecting the brain or optic nerve, such as a multiple sclerosis or stroke can lead to the visual impairment. Second is about autoimmune disease. Some autoimmune disease, such as a lupus or rheumatoid arthritis, can involve the eye causes vision problems. Environmental factors is exposure to harmful substances. Prolonged exposure to toxic substances like a certain chemical or medication can damage the eyes and causes vision loss. UV radiation is excessive exposure to ultraviolet UV. Radiation from sunlight or optical sources can increase the risk of developing eye conditions like cataract or vascular degeneration. Now, we move to definition and types of visual impairment. Blindness refers to the severe visual impairment where a person's vision is limited to the extent that they cannot see at all or can only perceive light. Visual impairment encompasses a range of conditions where vision is significantly compromised but not completely absent, including partial sight and visual blindness.
Category of blindness have a three. First one, B1, B2, and B3. B1 for athlete in category B1 have total blindness, which means they have no vision or have very limited vision, even after maximum vision correction. They can use mentor during competition to guide them around the field and arena. The second one is B2. B2 category athlete in category B2 have severe to moderate blindness. They have better vision than category B1 athlete, but still have significant visual limitation. They can also use mentors during competition. And the last one is B3. Athletes in category B3 have mild or partial blindness. They have better eyesight than category B1 and B2 athletes, but still have visual limitations that affect their performance in sport. This is example for category of blindness B1, B2, and B3. Types of visual impairment. Visual impairment refers to a condition where an individual experience limitation or loss in their ability to see, which can range from mild to severe. This impairment can affect various aspects of daily life, including reading, mobility, and recognizing face. The first one is low vision. People with low vision have some level of sight of experience significant difficulty with tasks, such as reading or recognizing face, even with the help of glasses or contact lens. Low vision can result from conditions like macular degeneration, diabetic retinopathy, or glaucoma. The second one is blindness. Blindness refers to the complete absence of vision or the inability to see anything, even when using contractive measures like glasses or lens. Blindness can be congenital, present at birth, or acquired due to conditions such as cataracts, retinitis pigmentosa, or optic nerve damage. Legal blindness. Legal blindness is a specific this this designation based on criteria established by government agencies or organizations. In the United States, for example, a person is considered legally blind if their visual acuity is 20 per 2000 wards in their better eyes with the best possible correction, or if their visual field is limited to 20 degrees or less. Total blindness. Total blindness refers to the complete absence of vision. Individuals who are totally blind rely on non-visual methods for navigation, communication, and accessing. The last one is functional vision loss. Some individuals may have significant vision loss but are still able to function relatively well in daily life with the help of assistive device, adaptation, and training. This category include people with communication-led albinism, where vision may be impaired but not necessarily absent. Understanding the different types of visual in crucial for providing appropriate support, accommodation, and resources to individuals with varying degrees of visual vision loss. By recognizing the diversity within the visual impaired community, we can better address their unique needs and empower them to lead fulfilled lives. Classification of blindness. Blindness can be classified into different categories based on the level of visual impairment. The first one is total blindness, complete absence of light perception and visual function. And number two, no light perception, and we call that NLP. For example, some individuals may have no perception of light at all. Number three, light perception, LP, ability to perceive light but no describe shape of objects. Number four, visual impairment, partial sight or low vision, where individuals have some level of vision function but with significant limitation in visual acuity or field of vision. The last one is legal blindness, defined by specific criteria established by government agency or organization indicating a level of vision loss that qualifies individual for a certain benefit or service. This qualification help in understanding the extent of visual impairment and determining appropriate support for resources for individuals affected by blindness. This is a Snellen chart of blind and visual impairment. Treatment and prevention of visual impairment. Treatment and prevention strategy for visual impairment depends on the underlying cause and nature of the condition. Here are some general approaches. The first one is medical treatment. These include surgeries, medication, or therapies aimed at managing specific eye conditions such as cataract, glaucoma, diabetic retinopathy, or macular degeneration. Corrective lens. Prescription glass or contact lens can help correct refractive error like myopia, nearsightedness, hypopia, farsightedness, and astigmatism astigmatism, improving vision. Low vision aids devices such as magnifiers, telescopic lens, and electronics and can help individuals with low vision perform daily tasks more comfortably. Vision rehabilitation program. The last one is vision rehabilitation program focusing on training and adapting techniques can help individuals maximize their remaining vision and learn alternative method for performance the the life activity.
Hello, my name is Nuri Sufina binti Ahmad Izam and you can call me Fina. My matrikan number 2023884444. Orientation and mobility (OM) is training is crucial for individuals who are blind or visually impaired to navigate their surroundings safely and independently. Here, an overview OM training. O is orientation. Orientation is this is aspect focus on understanding one position is space in the layout of the environment. The technique include using auditory cues, landmark, and spatial concept to create mental maps of surrounding. And the M is a mobility. Mobility skill involve moving safely and efficiently through very environment. And the technique may include can technique. The can technique is using a long can to detect obstacle. Trailing that using a hand to detect landmark, and the guide dog training for those who are suitable and interested. The next one is environmental awareness. Understanding environmental features such as intersections, stairs, ramps, and obstacles is essential for safe navigation. The next one is public transportation. The public transportation learning how to use public transportation system safely and independently, including identifying bus stop, reading schedules, and using assistive technology when available. The next one is technology. Utilizing assistive technology such as GPS, maps, and tactile map to enhance orientation and mobility. And the last one, problem solve skill. Developing the ability to solve navigation challenge independently and adapt to changing environment. The next topic is safety, health, and medical consideration. Safety, health, and medical consideration for individuals with blindness or visual impairment are essential to ensure their well-being and quality of life. Here are some key considerations. The first one, home safety. Implementing measures such as removal obstacles, securing loose rocks, using no-slip mats, and organizing belonging in a consistent manner to minimize the risk of fall and accident within the home environment. The second one is medical management. Developing strategies for safely managing medication, including labeling prescription, organizing pill box, and seeking assistance from healthy providers or caregiver as needed. The third one is physical healthy monitoring. Regularly monitoring physical health through routine medical checkups, screening, and examination to detect and manage any underlying health conditions or complications that may arise. And the last one, a mental health support. Recognizing the importance of mental health, providing access to counseling, support groups, resources, and to address emotional well-being and coping with the vision loss. The last part is a recreation adaptation for person with visual impairment. I show 5 activity the blind can do. First one is goalball. The second one is baseball. The third one is swimming. The fourth tandem cycling, and the last one is hiking and nature walks. Adapting recreational activity for individual with visual impairment or blind is essential for promotion inclusion, physical activity, and social engagement. So that's all. Thank you.